Hello, welcome to Concussion Conversations. My name is Chaandani, and I'm sitting here with Jenna Howe and Brynn Bicknell, and we're here to have some enlightening and interesting conversations about concussion as well as treatment options, and hopefully you enjoy. So myself, I am a PPCS strategist. That means that I work with people who are suffering with long-term concussion symptoms, and I help people reclaim their lives. I had an experience where I should say I experienced a life derailing concussion years ago. And after going through that experience and just seeing firsthand how many gaps exist in the system, um, I decided that I needed to step up and make a difference. Specifically, when I was at my worst and struggling every single day with a lot of symptoms and life limitations that followed, I was seeing a lot of different professionals. And so I very much, it could be anything from a vestibular physio to a chiropractor to a neurologist to RMT to so on and so forth. And also, I was seeking various holistic types of care on top of that. And what I kept finding was that, you know, the experts in their space are essential and they're highly educated and they know what they're doing and they treat this symptom or that bodily system, if you will. But I kept on feeling from my experience that I was falling into gaps between the sort of siloed system of treatment. And that's when, I realized I knew back then that I was going to step up and make a change in the space. I have done that now, and I'm very excited to be serving people directly who have, again, long-term concussion symptoms. I'm able to understand exactly where they're at, meet them where they're at, and help them to understand their mental energy so that they can get back to tasks that they miss, activities that they miss, as well as get back to doing multiple things in a day. So that is how I am serving this space, and I'd love to pass it over to Jenna to hear what she's doing.
Oh, thank you. So, I am an osteopathic manual therapist and a Bowen therapist as well. I started working in the concussion space, probably around 2004, 2005. And I've just sort of grown from there. So who I am as a practitioner is I'm naturally trying to fill gaps even therapeutically. So even just not in the concussion space, but just, if I reach my limit of what I can work with, and then I go and I seek an opportunity to learn something else that I can level up. And I've done that with working with concussed individuals, for 20 years now. And it's really my primary goal is to just help people feel better. Oftentimes I'm working with chronic situations. I do get some acute, but that's not necessarily, my role. I'm not like you'll hear from Brynn is a certified athletic therapist. Their role is more sideline, sort of originally, but by the time people find me, they're usually pretty chronic. And so I'm feeling that need that seems to be missed for those particular individuals who have been bouncing between physio and massage and chiro and all of the very sort of traditional modes of treatment. And then again, just always looking to help people feel better with their symptomology. I met Brynn in 2012 when I had moved from Victoria, BC. No, I moved from Toronto, Ontario to Victoria, BC. I met Brynn when I was out in Victoria. And so what I'll do is I'll pass the baton on to Brynn.
So my name is Brynn Bicknell. I'm a certified athletic therapist. I met Jenna while I was in school for athletic therapy, and what I saw her do with the concussed athletes that I dealt with made me go and become a Bowen practitioner as soon as I finished my athletic therapy program. I then got licensed in the US and moved there with my husband in 2018. And I worked as a licensed athletic trainer in Washington and Missouri. And what makes my profession a little bit different than Jenna's is that, as she said, I work on the sideline. So I'm right there when the athletes get the concussion. I'm the one that assesses them. I'm the one that refers them to the hospital doctors if need be. And I'm also the one that sees them every day, especially when I worked in the high school setting, to help them recover. And so what I really focus on, with my concussion athletes is I would kick everyone out to their practices, and then with my concussed individuals, we would turn off the lights and make the space really good for them and their recovery. And that's my focus, is the recovery. And then we work together with them to get them back into their sport. So that's where I feel like I have this I feel like I have a little bit of a different perspective than many other practitioners in that sense, because I'm there from day one back to the full return to play and competition. And the great thing, or great difference, I guess, about the United States and Canada was in the United States, I was able to clear athletes back to play, trumping emergency physicians and urgent care physicians as well. In Canada, it's a little bit different, where that can only be with medical doctors or not naturopaths, nurse practitioners. And yeah, please check out our next video where we delve a little bit more into the experience that you would have with working with us and our services. So Chaandani and Jenna, I heard you both mention that you're both working within that gap. Can you explain a little bit more about what that gap is?
Over to you, Jenna.
Yeah, so traditionally, what I noticed with people when they're coming into my office, so now I'm often treating the chronic situation, right? Because I'm not sideline. So what I've noticed over the time, so most people are sent to physio, chiro, massage. By the time they come to see me, oftentimes maybe they're a little bit better, but oftentimes they're not better. And the gaps that I notice is that they're not being treated as the whole person, right? They're being treated as, oh, your vestibular system is off and needs to have this and this and this. So it's very reductionist in its point of view, without taking into consideration the wholeness of the individual. So what I find that makes me a little bit different in terms of fitting into that gap is, like, I'm not going to manage. Other people are there to manage your situation. I'm not a case manager. My full focus is to actually get you feeling better in between all of those other things, where the physio is saying, well, you haven't reached these targets yet. And the chiro is like, well, I'm still going to do this, but you're still feeling like this. I kind of fit myself in there and say, okay, well, come on in here. We're going to turn the lights down low. We're just going to get you calm, and let's give you something that seems to be missed often, not all the time, right? Because every therapist is going to be a little bit different. So I'm talking in a general sense, but in general, people are not being treated as a whole person. And so when they come into my office, my intention is to take in their entire being. How are they feeling mentally, emotionally, physically? What's going on at home? What's their history? And how can I make them feel heard and comfortable while they're in my care?
I love that approach. And I feel like, on the patient side of things, being that I lived through that experience with chronic symptoms, that that is so important, because that's exactly kind of what I mentioned prior, is that it's just there's this siloed care that happens. And I have so much respect for all of the educated, incredible professionals that treat in those spaces, and they're absolutely necessary in my point of view. But it's like the in between. It's, for me, every time that I fell into a gap between service providers, I was left thinking, what about the human experience? What about the lived experience behind that? So hearing a provider like yourself say that, those things do matter, maybe a little bit about the person's home life or what they were struggling with that day, that's really important. And so I appreciate that point of view quite a lot. On my side of things, being that I have been in your shoes, I have lived it, I have felt unseen, I felt unheard, I have improved in a lot of ways, but I've still had struggles. I have this really unique point of view where I'm able to really meet clients where they're at. So the people that I am best at supporting are people who are struggling with long-term concussion symptoms, otherwise known as PPCS, or persistent post-concussive symptoms. A side note, a related note, you might have heard of it referred to as post-concussion syndrome as well. All of those terms really do describe, again, the clients that I'm best at serving, is I'm able to, understand what they're going through. Something really, that stood out to me in my experience was going to all these different providers. It was, the vestibular physio, the chiro, the RMT, the neurologist, so on and so forth. And when you'd arrive, you'd have these questionnaires of 1 to 10. How are you feeling? Rate this. What about this symptom? You're nodding. I'm like,
Yeah.
yes, approach. And what I found is it was hard and frustrating, and I was already overwhelmed. It was very hard to process what was being asked of me. It was really hard to quantify on numbers how I was doing. But most of all, excuse me, most of all, it was like it didn't capture my actual experience. Like I had gotten myself to said appointment. I had somehow driven there. I had somehow shown up. It was my third of the day, so on and so forth. But there wasn't a space for me to express, oh, well, I'm actually really hungry because my brain wasn't working and I couldn't figure out how to feed myself this morning. I couldn't remember what it took to put together a yogurt parfait. I couldn't figure out or remember where I put my apples. And it's like those pieces of lived experience. So on my side of things, when I work with a client, I'm able to really meet them where they're at and ask the right questions to understand what's going on. I'm able to as well, the main thing I do is work with people to help them understand their mental energy so that they're able to optimize how they're showing up in their day and get back to activities that they miss or get it back to doing multiple activities in a day. And the cool thing about this is that my services really are complementary to medical and body-based treatment. So they're meant to just slot right in. It's complementary, um, you know, support the person outside of appointments. And yeah, I'd love to hear from Brynn as well and your take on gaps and how you can fill those.
Yes, so I traditionally, as medical practitioners, we do like to have assessments. However, assessments tend to increase symptoms. And when you aggravate symptoms, people are not going to have the best experience in a treatment session. So I tend to limit my assessments upfront if symptoms are high and focus on that symptom reduction so that we can deal with things when things are much calmer, and then address those other little lingering things as we're clearing up the symptoms. And I will say that it is hard in a session to give someone information to manage their whole life and provide a treatment. And so it's a great thing that you're offering to people so that they have more help when they're at home on their own.
Yeah.
Because I can only give a few guidelines to them, but to go through everything that they may have trouble with is too extensive in the time period available.
Yeah. And that's exactly the thing. I think there's been some situations where I have been pretty much the only care provider for somebody. And we're only one person who does not have the capacity to do all of the things for that particular individual. And so sometimes they don't need an occupational therapist and they don't need all of these very sort of clinical, sort of set up situations, but they need somebody to help them go, okay, like if I give them, say, the Parkwood pacing handout and I can discuss it, but at the same time, I cannot be there for that person all the time to help guide them through that. So having someone like yourself is so important so that they have that advocate who can say, okay, your practitioner gave you your Parkwood pacing. Here's how this is going to go. And here's how I can support you in that. It can be challenging from a clinical space to know that you have all the information to help somebody through all those pieces, but that you just don't have the capacity to do so. So it is important to know who is out there in the community that you can guide people towards so that they can, like yourself, Chaandani, to then help support them in all of those other pieces that Brynn and I just don't have the time to do. Even if we wanted to, we just don't have the time to provide that ongoing support.
I mean, that's exactly the beauty of of this whole setup, for example, because you two are the experts in the actual, understanding concussion and understanding how to treat and identifying symptoms. And correct me if I'm wrong, I don't want to misspeak on your behalf, but that's my understanding. I know that you two are definitely experts in actually working with the person on those levels. And for myself, like you said, I'm able to come in to support, between the treatments. And I think it just makes sense. We keep the experts treating exactly as they do, and then I'm able to come in, provide that additional layer of support, also help people feel really understood and really seen as they're progressing through and as they're hitting certain maybe bumps or just needing someone to speak with who really understands it. And I'd like to add as well that something that really stands out to me about the way that you both treat is that it's concussion-informed care you provide. And, I'm sure you have much more to share about this, but even just a few moments ago, you both shared something along those lines, which to me instantly, I flag and I'm like, oh my God, that stands out. That's incredible. With Brynn, you were saying that you're very mindful of concussion symptoms, and so you limit your assessment. Again, I don't want to misspeak, but it sounds like you limit the assessment, maybe the questions or the way you're asking. You find ways to really meet that person where they're at. And Jenna, you just very, high level mentioned the idea of turning the lights down in the clinic for the appointment. And
Yep.
that is mind blowing in this space because that almost never happens in a clinical setting, both of what you're sharing. So maybe you could talk a little bit about how you take a concussion informed approach to how you treat.
Yeah, well, that's just it. I mean, and this conversation just happened with a new patient that started the other day. Is as soon as I look at the intake form and there's light sensitivity or visual issues, I immediately turn down the lights in the clinic room, and they immediately are just like, ah, thank you for doing that. To Brynn and I, it seems like an obvious, like, why wouldn't you? But the vast majority of clinic situations don't do that. And so it's those tiny little things that you learn over time as you work with different people that you start to pick up on what's really important to people. They want to be able to just take their sunglasses off. They want their nervous system to feel calm. They want to feel like, in the cloud of what they're experiencing, that they're in a place that's actually emotionally and physically safe for them to be there, because you're in a vulnerable situation. You don't know this person. You may have had some adverse experience with therapists over months or years prior to this. And so I think for me, being concussion informed is just honoring the fact that they're in a place that they're feeling really uncomfortable and really vulnerable and really sensitive to everything around them. And it's part of my job to make sure that I'm setting the stage for the best possible experience.
Yes, I would say that the other thing that I really try to focus on is listening to what has worked for them, what has not worked for them, and really identifying those things that trigger those symptoms more than anything else and focusing on that part as well. I think recently, Jenna and I have one that's seeing both of us, and they came in and said they went to see a 3D film, which caused the symptoms to come back. And with that, the eyes act a certain way. So it's a certain muscle in the eye that then we can go and figure out why that muscle is causing this to go backwards instead of staying where it is. And we can make that correction as things pop up. So it's really being in tune with what they're saying and addressing those issues that they're having.
Absolutely.
I mean, that's fascinating. On my side, I do not have a medical background and I don't intend to go back. So when we took a little break, we started naturally having this great conversation about a very hot topic, which is PPCS, or persistent post-concussive symptoms. I'm really excited for us to bring this conversation over to a recorded version so that we can share with others. Because, maybe I'll just share on my end. My understanding is that the normal trajectory of healing for concussions is that, we expect that the symptoms will start to resolve within a few days to a few weeks. And when it hits the point of 3 months where someone is still, having a lot of symptoms or having new concussion symptoms appear, that's when it starts to be considered persistent symptoms. And that's when someone is kind of shifted into the persistent post-concussive symptom category, if you will. And that can go from, a few months all the way into multiple years. What do you two know about this topic?
Well, I think it's interesting because over the years, right, because I've been in this space for 20 years, I've seen a variety of different conversations around what is considered chronic versus acute, and it's different for concussions than it is for your other sort of other injuries. So the conversation used to be a few years ago that if it's anything over 9 or 10 days, it's considered chronic. And then I think then it was like, okay, well, then it moved to like 9 to 14 days. The average concussion will kind of heal on its own. I'm obviously a bit biased because the vast majority of people I work with are chronic. By the time they come to see me, it's been a month, 4 months, 4 years, depending. So I think, and it can be really tricky because they're getting diagnosed in Canada by the physician, and not every physician, how do I how do I say this?
It's not a part of their curriculum, so they
Yeah,
have to get that extra certifications or take those extra courses.
yeah. So you could see three different physicians, and they're going to have three different um, levels of diagnostic criteria for that particular individual. And that's oftentimes their first line of contact. So for one person, they could go and they see the physician, and it's been 10 days. The physician's like, yeah, you've got chronic post-concussion syndrome. Another, they could go to another physician. They say, oh, well, just give it another month or whatever, you'll be fine. So it can be pretty ambiguous from what I see from the individual. And so these days, I kind of look at it as, okay, if it's been more than 2 weeks, you're into that category. But if it was like a knee injury, I think Brynn would know this more than me. I think it's like 72 hours you're considered chronic from a specific injury.
Yes.
I don't see why that wouldn't translate to also head injury. But that's just maybe my unpopular opinion.
Yeah, so I have a different perspective because, like I said, I see mostly acute when they happen. And so um, with youth, they tend to take longer to heal. So it's normal to see them have symptoms a little bit longer than with adults because their brains are still developing. And when we look at all of it, when somebody reaches that month mark, I start to really put them in that persistent category as well and treat them that way, just because that is unusual if they're having the treatment from me and Jenna in that specific space. When I've done the treatment on somebody who had it immediately, symptoms disappeared within an hour. So it's become one of those things where we when we see a trend, we expect to see an outcome. If that outcome doesn't come, that means there's other factors at play and that we have to treat them as such.
And how fascinating is this to hear? I mean, it's one of the biggest, I guess, issues, if you will, in the space, and in my opinion, and I feel in the opinion of others, is that they're, finding it as a patient, for example, finding information on what is concussion, what is post-concussion syndrome, what is persistent post-concussive symptoms, how do I help myself, what's wrong with me. It's very much this space that is, again, quite siloed. I look at it almost like you have to patchwork information and kind of bring it together. And I think what we're seeing even in this conversation is, it's so interesting because this is a perfect example of, how, whether through experience or learning or speaking to others or whatever it is, we all have a slightly different understanding of what it can look like. And very much that translates to Google, and that also translates to all the different providers that work in the space to serve the concussed population. And this is one of the biggest things that actually fired me up to step up and be like, no, I want to lead change. I want to make this easier. I want to meet people where they're at. I want to find ways to all bring a lot of people together to create an accessible education for the public. Sorry, it sounded like I said inaccessible. I think I said an accessible. I just would like to clarify. I'd like to make education accessible to the public and globally.
Well, and I think it's when we're looking at, like Brynn mentioned that, youth, actually, I would want to ask when you say youth, are you talking like 8 to 11, 11 to 16, because what I notice is that the youth in my clinical practice that take longer tend to be the under 13 group, but the 13 to 18, uh, especially the male athletes, and we can have a huge conversation on gender differences, age differences, how the concussion was received, if it was football versus a car accident. These are all things that I think both Brynn and I have seen where what you usually expect starts to scatter into something completely different, and then the anticipation of a longer recovery is met with, female and the hormonal cascade, depending on where they are in their cycle, when they receive their concussion, overall strength, if it was a whiplash, if it wasn't a whiplash. Um, and
Yeah,
there was something else I was going to mention too, but I can't. Oh,
depression,
dizziness.
anxiety, ADHD, if they have all these underlying factors, they've
Yeah.
just been shown to have more. So that's the difference with the treatment that we do. Youth respond really well in that 14 to 23 category, I find really, really well, unless they have one of those other factors. And then it becomes more like treating them as if they have those persistent concussion symptoms, like you were mentioning. But this is with the traditional methods that are being used, or the conventional methods that they're finding in those studies, that the younger athletes, so under the age, I think, of 18, do take longer because of their developing brain. So it is normal to see the symptoms maybe go into that 14 to 21 day where they can recover on their own without any other intervention. And individuals, like adults, may recover within 5 to 7 days without any other intervention.
I really enjoy speaking to both of you for a lot of reasons, but one of the most interesting things when we first connected, actually, that stood out to me was this: you both have this expectation of much shorter timeframes, shorter timeframes in terms of, as we're hearing today, like what you will consider chronic or long-term, but also shorter in the sense of you expect the person to be improved or improving greatly within a very tight time frame compared to a lot of other systems or providers per se. So that's really stood out to me. Maybe you can share a little
Well,
bit more on that.
I mean, it's hard to, what Brynn and I do are quite unique. So we do, similar treatment. We have a treatment protocol that we both use. It's the same. It's kind of a tried and true, but we also both have different backgrounds, feeding the information that we're looking at when we're looking at that particular individual. So it's difficult. We had started sort of like a mini research project that never really finished, and that was more on me than anything else. But anyway, and when I was researching, this might have been about 10 years ago, but so I know some of the information is going to be a little bit antiquated by now. But at that time, it talked about what the conventional treatment for concussion with physiotherapy related like neck pain. And what they figured was a positive, like this person is healing, was over, I think, 4 months. And if they got 50% better in that 4 month time frame, they could considered that a success.
Mhm.
That wasn't anything other than the odd person. And again, we can have another conversation later about the different types of situations that we've both worked on. That just seemed completely unreal. Like neither one of us have spent 4 months on neck pain related to concussion unless it's a really extreme situation. So I was like, wow, that's considered, it never occurred to me that that was considered like gold standard treatment. And it was the same thing, I think, for chiropractic. I think the physio was, I think, multiple times a week for 4 months. And I think the chiropractic was once a week for, I don't know, 2 months or something like that. And again, 50% resolution of symptoms, that was considered amazing. I think the reason why Brynn and I expect something different is that because we see something different over
Mhm.
and over and over again. So we know what we're looking for. If somebody's like, whoa, wait a second, they're not responding, what else is going on?
Mhm.
How were they, like, I analyze how they were injured. So if it's an athlete, I'm like, well, what stance were you in? Where did you get hit? What hit the ground? Did you have two hits? Where did they hit you on the body? I'm trying to look at it from all angles so that I can figure out what's holding their recovery back.
Mhm.
So I'm always looking at it from that perspective. I don't know if that makes sense. That was my little mini rant.
No, it does. So I guess the difference that I see is that most of these athletes, when I was in the high school, they had had concussions previous to me working with them. And one of them believed that their entire football season was done because they got hit really bad, most severe he's ever had symptoms. And the year prior, it had taken him 2 months to heal from his concussion. So he believed his season was done. Um, Within, I would say, 2 or 3 days, his symptoms were gone and he was already into his protocol to return to play. And by the next week, he came up to me and said that he had thought, because he was a senior, that his entire football career was done. And he was so thankful that he got to play in the playoffs and the rest of the games for the season. And it just kind of shows you that when people don't know of the option, they don't even know to even look for it. And so if we're seeing these results all the time, like I'll treat someone and then they walk out to their practice. By the time they walk out to the practice and I get there, they're telling me that their symptoms are really reduced. They're feeling really good. So when you see that over and over and over again, when somebody doesn't have that response, we're like, why didn't you have that response? What makes your concussion different? What do we need to investigate?
Yeah.
And then with that, I also found that other athletes that had had treatment from me would get another one and they would be more open to telling me, even if it was minor and everyone was telling them they're fine and they're cleared by physicians. They were like, no, I'm not okay. And I know that your treatment will get me better because I know I'll be back. I might have to miss one game, but I'll be back by the next game because I know I can get better in a couple days. And so they're pulling themselves, even
Mhm.
though their whole family, doctors are telling them they're fine. And
Mhm.
so that's kind of an amazing thing to be able to provide.
That is an amazing thing to provide. I mean, from a quality of life, from in your case, athletes returning to play, it's giving people that hope that there is a way forward. In, what I see with, in a one-to-one space with people who have PPCS who are struggling a lot, is that they can. I mean, there are a lot of variables, and I don't want to make it sound like there aren't, whether it's pre-existing conditions or factors or the level of treatment they received, or maybe they are untreated, maybe they missed early intervention. There are so many variables, which I acknowledge. But people, it's very easy once you hit as Jenna would say, the chronic, or as I would say, the long-term space of PPCS, where you're a few months and a few, or maybe more than a few years in, is losing hope and feeling frustrated and, asking yourself questions of, am I feeling depressed because my life is totally at a standstill? Or am I feeling depressed because my brain is injured? Like you're kind of focused on questions like that, and you've lost the luxury of the big dreams and the forward momentum that you had in your life. So it's very exciting for me to sit and talk with people like yourselves who have had these experiences and consistently seen people getting back to where they need to be and to a place where they're comfortable post injury.
Yeah.
Yeah, sorry, I was just gonna say that I definitely think you're right about that. The earlier that people can get treatment, the quicker they're gonna see the results, the less they're gonna stress their system and have to deal with that in the long term.
That's it. And oh, sorry, Jenna.
Oh, well, I was just gonna say, I was just thinking about somebody that I worked with recently who is sort of in the healing space, so already had, you know, having a collection of practitioners was already part of their world. So within days of their car accident, they were seeing chiro, acu, massage, and I think very well concussion informed therapists. And so it really helped. And so it's been what, I guess 6 weeks. And so she's coming to a bit of a stalling point in her recovery. And now she's coming to see me. But what's interesting with her is that she went and sought help immediately. And I think her experience was quite different than those who had to wait. Now, this person, I don't have any idea if they're in the sort of the insurance and all that kind of stuff realm of things. All those factors, not sure, but it's definitely a different experience of when she comes to see me. We're just leveling up the healing as best we can, right? She's recognized the limitations in her personal experience of where she's at versus the people who didn't really get anything for a couple of months because maybe it took 6 weeks to see a physician and they really kind of followed that very traditional medical model, and the rate of recovery from anecdotally was much slower versus somebody who's like, okay, I got injured on the first of the month and I was immediately to see somebody on the fourth of the month versus the 30th of the month. Like, I think both Brynn and I have seen many, many times the difference between somebody who comes to see us within the first week versus they waited because their doctor told them, wait a month and you should be fine. And then they waited a month and it's like, and again, this is probably a different offshoot of conversation, but neuroplasticity starts to set into the nervous system. Now the brain is learning a new default pattern and their level of homeostasis is now changing, which means then it works a little harder to bring it back to where it started.
Yeah, and just the idea of people waiting for treatment for whatever reason, and I'm not assigning blame whatsoever. I'm just saying that this happens way too commonly. Concussion is such an incredibly common injury, yet it remains underdiagnosed and underserved, and really not well understood by, some professionals as well as by the general population. And this is something that's also really lit me up in going through the experience and also in what I do know to really show up and make a difference and ensure that re-education is brought to the general public, because I think the only way to, for people to be able to heal at a level that their body can is to know what options are available and to know a little bit about it and to be able to advocate for themselves. And hopefully, in the most ideal world, everybody would immediately have early intervention and they would work with only concussion informed care providers, but that's just truly not always the case. So for me, I do work with people one-on-one, but also I'm developing a clinical partnership program where I'm supporting clinics. I'm also delivering workshops to clinics and schools, to be honest. It's trying to get information out to people on concussion, on PPCS, just to really get people talking about this as well, because it's that lived experience that often people don't talk about and it's not acknowledged. And this is specifically when people are in the long-term concussion category, the PPCS category. That often gets overlooked. And in my experience, once you're able to start talking about it and being honest about the level of struggle that you're experiencing, beyond just saying like, oh, I'm struggling with memory, but actually saying things like, wow, I can't leave the house without two shoes on my feet and I don't know what's wrong and this isn't me, and then explaining how that affects someone emotionally. That okay, we're just going to cut off because I thank you for the warning, but I got distracted. I was like, oh no, how am I going to end my point?